Yeah.
Was interviewing
Okay, whenever you get ready to start.
Okay. Hello, I am Dr. Michael Taylor. I'm a professor of pediatrics at the University of Alabama, Birmingham, Department of Pediatrics, and director of the Child Abuse Pediatrics Division. My topic today is medical evaluation of physical abuse and neglect in children. I do not have any commercial endorsements or financial conflicts. I won't be discussing any off-label uses. I'm going to review some medical and legal definitions of child maltreatment, spending most of the time on physical abuse and trauma. Go over a little bit of the reported and estimated frequency of child abuse. Spend most of the time talking about the medical evaluation of child physical abuse and frequency of significant findings in those evaluations and how that relates to child abuse investigations. Some case studies that we'll come back to. This child with the injury to the forehead and the bruising under the eyes. The history is the child tripped while running and fell and hit a cabinet. This 7-month-old has the injury on the cheek. The history was fell from a couch onto a carpeted floor. This toddler was walking and bumped the door and his eye swelled up right away is the history. This 6-year-old girl came in with this injury on the buttocks and upper thighs, and the history was the child fell off of a porch onto a concrete walkway while she was wearing blue jeans. So the definition of child abuse, this is from the CAPTA, Child Abuse Prevention and Treatment Act, that talks about an act or a failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse or exploitation, or presents an imminent risk of serious harm. We divide child maltreatment into 4 categories: neglect, physical abuse, sexual abuse, and emotional abuse. You'll hear emotional and psychological abuse be used interchangeably. Legally, throughout the world, child maltreatment, child abuse is defined as under 18. So on their 18th birthday, they no longer falls under child abuse laws or statutes, and that's true internationally as well as throughout the United States. The National Center on Child Abuse and Neglect has been charged with collecting data from all the child protective services throughout the 50 states and Puerto Rico and Washington, D.C. since 1991. They publish every year in about January. The most recent we have was 2018, published this past January. In that 1 year, you had 74 million children under 18 in the United States, 1 million in Alabama, with a population of 4.8 million in Alabama. And you had roughly about 29,000 child abuse reports with 40,000 children involved, and about a third of those substantiated, which amounts to about 1% of Alabama children reported being victims of abuse in 1 year. About 4% of them were evaluated as potentially abused. If you look at who makes the reports, the highest number of reports are from teachers, followed by law enforcement, and then social work, and then medical personnel. COVID-19, the pandemic, has had an impact. The Alabama Department of Human Resources, as of this month, reports a 28% drop in child abuse reports since March. Not too surprising when you look at who makes the reports. And the 20% are from teachers, and they've not been in school, and 10% are from medical personnel, and they've not been going to the doctor. So that 28% drop is fairly predictable. Most of the reports coming in tend to be younger, with the highest number of reports being, a fourth of them being under a year of age. By category, about a little more than half, 60% in the United States are neglect, with physical abuse being 10%, sexual abuse 7%. Alabama's statistics are a little bit different since the Great Recession of 2008. We have a higher percentage of physical abuse and sexual abuse reports, although it has more to do with what's reported than what's actually happening. So about 1% of U.S. kids are determined to be victims of child abuse each and every year. It's about 10% of injuries to children under 5 showing up in emergency rooms. In the most recent year, there were 1,770 deaths reported in the United States due to maltreatment. 43 of those were in Alabama. And we estimate from adult surveys that about 2/3 of child maltreatment cases never get reported. Compare this to other disorders we deal with in pediatrics. Cancer is, of all types, is about 3.5 per 1,000 children. Diabetes is half of that, about 1.5. Cystic fibrosis in Caucasians, from certain parts of the world, is about roughly 1 per 3,000, or about a third of 1 per 1,000. Child abuse is right at 1%, or 9 per 1,000. But when you compare things, more common things like asthma is more common, but child abuse is more common than cancer, diabetes, cystic fibrosis, and a number of other things that we deal with on a regular basis. The perpetrators, the people who are abusing the kids, it's more often the parent than anybody else. So 90% of the time it's one of the parents, and another 3% are the unmarried partner of the parent, and then relatives. So if you take all the relatives and the parents, it's 95% of all types. Most of them are in the age group that you would expect that are having and taking care of children. A little more than half are female. So they don't break it down by category since 2012 because of cutting in funding to NCAN. But when they were breaking it down, sexual abuse is very different than physical abuse and neglect, where parents are still involved but not the same frequency. When they die from neglect the most, but physical abuse is next. And when they die from physical abuse, it's mostly abusive head trauma and then abdominal injury in that order. So half of the children who die from child abuse are under a year of age, and 3/4 of them are under 4. So most of them are the smaller children. When they die, 4 out of 5 times the perpetrator was the parent. And about 1/4 of the children had current or prior contact with Child Protective Services, which is the Department of Human Resources in Alabama, which means 3/4 of them, the first time the DHR found out about them was at the time of their death, which is not going to do very well to prevent. And it is more common than deaths due to meningitis, leukemia, AIDS, and is one of the few leading causes of death to increase in children. There are risk factors that put the child at greater risk for maltreatment, which if you're evaluating a family or a child in front of you, is not going to help you at all. But if you're trying to prevent child maltreatment, it's where you'd want to put the money. So prematurity and disability in general increases the risk for child maltreatment about 2.5 times. Boys are more likely to be physically abused and girls are more likely to be sexually abused. Parental risk factors include things like not really knowing what you're doing when you're taking care of a kid. And we don't do a good job of teaching parenting, certainly in schools, churches. So most parenting is taught by what's done to them and what's done around them. A big one for physical abuse, particularly past the year of age, is the use of corporal punishment as a form of discipline. And then single heads of households, low education, mental health problems, substance abuse, and then interpersonal violence in the home. Domestic violence is a big risk factor. If you have a child who presents, particularly under 5 years of age, to the medical provider and they do not identify the injury as being inflicted, the odds of that child coming back with another injury is estimated to be somewhere around 50%. There's some parents who get upset, they do something to the kid, they regret it, and then they don't do it again. And then others who come back again, and sometimes again. And so if you find a case where there's evidence that it's happened more than once, the odds of that continuing to the child are much higher. So for the children under 5, if it gets missed and they go back home, about 5% of them come back dead, and 25% with more serious injuries. If you have one child in the home that's identified as being physically abused, and you evaluate the other children in the home, about 1 in 5, or 20% of the children in the home, particularly siblings, will have findings that they were victims of abuse as well. There are an awful lot of long-term adverse effects from child maltreatment that's been gone through quite a bit in recent years. Most of the abusers were abused as children, and a lot of school failure, violent acts, low socioeconomic status, and a number of other things. So physical abuse of infants is usually triggered by frustration of caregivers due to inconsolable crying, which starts around 2 weeks of age, peaks at 2 to 4 months, and starts to fade at 6 months. And the incidence of physical abuse in that age group is identical to the curve of the inconsolable crying in infants. Past the year of age, it's usually excessive or inappropriate administration of corporal punishment. The whole idea that pain is a good negative reinforcement to teach children is still widely used and believed in the United States. And if one level of pain didn't work to teach the child, escalating the pain until they get their attention can lead to injuries. So we tend to see certain physical abuse patterns fall into patterns of injury. These countries across, the first country to ban corporal punishment in the home was Sweden in 1978. And it took, at the time, their incidence of corporal punishment in the home was identical to the United States, somewhere around 75, 80%. In the decades since, they have had marked declines in physical abuse in the older children, meaning past the year of age. They still have problems with the infants and abusive head trauma in the under a year of age. In the United States, we ban it in certain school systems, although it's legal in Alabama. It's not used in very many school systems in Alabama, but still there. But in those countries that have banned it in the home, they are seeing declines in physical abuse in the older children. So as of this year, corporal punishment is currently banned in 64 countries, but still legal in the United States and Alabama. So as a medical professional, when do you report a child as having been abused if the corporal punishment has been used? And any corporal punishment that causes a physical injury, including bruising, abrasions, obviously broken bones, or emotional injuries. So if you have an 8-year-old being whipped in front of his peers or at school or somewhere else, clearly that child is at risk for a more serious injury, and that family needs help. And so would warrant a report to DHR, because that family needs help in knowing how to deal with a child and how to discipline a child. Physical abuse injuries, the most common are skin injuries with bruises, number 1, cuts, number 2, burns, and then broken bones, and then abdominal injuries and head injuries. With bruising, we expect bruising in mobile children, but prior to the age of mobility, so an infant under 6 months and before they're pulling up and cruising and all, bruising is less common. We expect bruising in mobile children in common places, so in this, along the shins and the knees and somebody who's mobile. We don't expect it so much in areas, because they're not running backwards at all, but in areas where corporal punishment is more likely to be administered. So with bruising, you have to look at the age and the ability of the child, the shape of the bruising, patterns of if you have it, and then certain regions. So bruising prior to cruising is rare in pre-mobile children, so prior to 8 to 9 months. In this particular case example, this child is 2 months old, has a bruise on the eye, and reports having been that the child did it to themselves with a pacifier, which doesn't fit. This is a study, it came from a study from a couple years ago. The more common bruising is along the bony prominences, the forehead, elbows, and again in mobile children, whereas areas where corporal punishment are often done is not a common accidental area for bruising. There's this particular mnemonic that's been developed recently. It's called 10-4 faces P. The 10 stands for T for torso, so bruising the chest, abdomen, back, buttocks, and then ears, neck, under 4 years of age, or any bruising under 4 months of age is concerning and worth considering and maybe doing a full workup. And then if you add in the frenula, tearing or injuries to the frenula of the lips, upper and lower lips, or the tongue, angle of the jaw, the cheek, eyelids, scleral hemorrhaging, and then pattern bruising, all would be concerning. So the bruising along the back, as in this picture, bruising of the ear, bruising of the face, neck injuries are not common in children from accidents. The ear injuries particularly are less than 1% of accidental injuries. This is what it looks like if a child gets lifted by the ear. You get bruising all along the ear and behind it, as opposed to slapped on the side of the face and have bruising on the ear in that location. Neck injuries, again, not common from accident, but if they're grabbed or choked, then you see them, so they're concerning. Infants who are not able to crawl or pull up to stand don't bleed often. If they have facial bruising on an infant, you have to think about intracranial injury and consider doing imaging. And in any child under 2 years of age, if they have concerns for physical abuse, including suspicious bruising, they should have a skeletal survey done, and depending on under a year of age, probably a CAT scan of the head or similar intracranial imaging. And certainly with any head injury, should have the intracranial imaging. Slap marks will produce certain patterns that sometimes will show up in pictures that look more like this in real life. And this is a type of injury that you'll see from a flexible, thin object. This happens to be bamboo. In Alabama, we see hickory switches used more often. This is more typical for the type of injury with something a little wider but still flexible. In this case, a belt. And in some cases, the belt mark may leave a pattern that you can even identify what the object was that actually struck the child, but that's not terribly common. As they start using something that's more stiff, you get a different pattern because it doesn't wrap around the edges as much. This happens to be a PVC pipe used to punish a child with on the buttocks. And any kind of whipping that causes bruising is force that's much too great a force and would be inappropriate and would be child physical abuse, and definitely worth reporting. Extension cords are very popular in parts of the United States, including the Southeast. And again, most parents learned how to discipline by what's done to them and what's done around them. We don't teach it usually in schools or in churches, and so they use what was used on them or what their peers are using on their children. Extension cords are popular in the Southeast, and they'll produce certain pattern if they're coiled or if they're uncoiled with that. This has been more recent in the last few years. In this particular case, these marks were caused by this kind of object, a chip clip. And again, the whole idea that pain is a good negative reinforcement. So if you do this, I'm going to hurt you, but it didn't keep you from doing it. You did it again, that it didn't hurt you enough, so I need to up the level of pain, can lead to a problem with escalation. Bite marks. There's this idea among some people that I need to teach them not to bite by biting them back so they'll know not to do it, which is really a bad idea, but is still believed by some. And if the distance between the canines is 2.5 centimeters or greater, then we know it was an adolescent or an adult and not another child. With unusual bruising or paddling causing bruising and all, you should do a basic lab workup for clotting studies because if it's going to be claimed that they have easy bruising, and occasionally they do. And that would be a CBC with a platelet count, a PT and a PTT. If there's a lot of bruising, you probably would add in a von Willebrand factor panel. And if they have abusive head trauma, you add in a DIC panel as well. For cuts and abrasions are number 2 after bruising as far as frequency in child abuse. The kids get restrained and tied down or held and stuff. They're gagged, and other sorts of things may leave certain types of injuries. So you have gag marks and restraint marks that'll look, this is a case of a restraint mark. This is an example of a gag mark on a child. This is, in this case, was a ligature. It was a rope that was used in the case where the child was being sexually abused. If they have constriction of their neck to the point where the arterial flow is cut off into the brain, they won't have petechia. If they have the venous return cut off but the arterial flow continues, then they'll get this petechia above the injury, much like you see scattered on this child. Burns are a common injury accidentally, and roughly 80% of the burns are due to hot water, top burns, but there are other types of burns we see as well. About 10% of the burns that occur in under 6 years of age are inflicted, meaning abusive injuries. If there are multiple children in the home, the youngest is the most likely to be the victim. Risk factors include developmental delay, including speech delay. Most of the perpetrators are the parent, or the mother's boyfriend, and burns can be quite serious. About 10% of them wind up dying. Most of the burns are due to hot water, tap water. About roughly 10–15% of the burns that we see in children under 5 are inflicted, meaning abusive burns. Accidental burns tend to be food and liquid injury burns. Bath water, for most people, is around 100 degrees Fahrenheit. Adults find it uncomfortable at 112, very painful, and most of your hot tubs are at 104 to 105. Most of the hot water heaters set at the factory around 140 to 148, and most people don't even know you can dial them down. The American Academy of Pediatrics recommends setting them at 120 degrees because at 120 degrees, if it's full on hot and the child touches it, it would still take a couple of minutes or more to get a significant burn. And that's where they get the 120 degree recommendation. But a lot of the hot water heaters, particularly in apartments and all, will be set at 130 or higher, and they'll get burns almost instantaneously. With burns, you look for patterns. Does it match the history of the injury? Cigarettes produce a certain pattern, and again, this is the whole idea that pain is a good discipline technique. Some people will use that to discipline a child with. It tends to be, if they're the commercially available cigarettes, they'll be around 8 to 9 millimeter in diameter with this eschar, the burn in the center, and then surrounding edema, which sometimes gets misinterpreted for impetigo. Impetigo may look like it, at least to some people, but there's no eschar in the center of it. It's just going to be a thin layer of the top part of the skin be lost, as opposed to this burn in the center as well. This kind of burn we don't see as much because people aren't using the automobile cigarette lighters as much anymore, but still can be done. We do see this one, though, where people will heat up their cigarette lighter and then use it to brand the child, or use other objects, in this case, forks being used. Accidental iron burns are very common in children, but also can be used as a form of discipline and cause an inflicted injury. This is more typical for an accidental burn, where a glancing blow when the child grabs the cord or knocks the ironing board and it falls off and hits them on the way down. Hot water immersion burns, that people run the water, they don't check it with their own hand, they put the kid in the water, and if the water's too hot, and in particularly 130 degrees or higher, they get burned. The part against the tub will be spared, the part above the water, and then the parts that are folded will spare contact with the water. So will look more like this with sparing, where they are pushed down against the tub. In real life, will look more like this. So this is where the child was pushed down against the tub. The part that touches the water gets burned. The parts that are above the water get spared. Symmetrical burns in a young child like this, are always suspicious. This particular case, this child was a budding artist who was painting the hallway with his own feces, and the guardians took offense, decided to teach them a lesson while cleaning their hands and put them in hot water, didn't check the temperature ahead of time. This is more typical for an accidental burn, where they reach up and grab the teapot and pull it over, and it comes down and splashes on their face. There are injuries that mimic abuse. We expect bruising along the shins in mobile children. And this is a technique that I have seen video of, but have not actually seen in person, fortunately. But in Southeast Asia, they use this technique of warming up that oil, taking a coin, dipping it in the oil, and pressing it along the spine away toward the ribs, and they get this impressive looking change in color of the skin, but isn't actually painful for the child. Mongolian spots that are more formally known as congenital dermal melanocytoses. We see them in 90% of people of African American descent, but you can also see them in 50% of people from the Middle East and Asian Pacific is around 70%, but Caucasians of Northern European descent, 10% of them will have them as well. People are used to them in the lower spine buttocks area, but they can be anywhere their skin except for the palms and the soles, where you won't see them. This child has these marks on the legs, and it turns out the socks were too small for them. This is a famous case where a child came home from daycare. The mother went to give her a bath. She had this injury on her buttocks. When they investigated, after it was reported, they had 2 other children with similar, and they were cleaning the toilet seat with undiluted Clorox and not rinsing it off. This is a case where what we call phytophotodermatitis. The mother was cutting limes on the back porch, making margaritas, had lime juice on her hands, turned around and held the child for a minute, and then went back, and with the sunshine, the lime juice got these marks that can look pretty dramatic. Some people are doing paintballs for fun, but if they're using it for punishment, then that would be physical abuse. This child had a shoe that didn't fit them. This is, again, impetigo. They got misidentified as a cigarette burn. Broken bones would be next on the physical abuse list after skin injuries. Most of the fractures occur that are accidental are usually school age. They have to be big enough to be able to climb and move fast enough and ride bikes to get injuries. Roughly about 10% of all pediatric injuries or fractures, and roughly about 15% of those are inflicted, particularly the younger kids. So most of your inflicted injuries, the child abuse injuries that are broken bones, are under 18 months of age, and about 1/4 of the fractures under a year of age are inflicted. When you're trying to look at fractures, it's always the history. Does the history match the injury? So if you've got a 6-month-old and has got a broken leg, supposedly did it on their own, it's a stretch. So young kids, most of your accidental injuries again are school-age children, and you have to think about it under 2 years of age. If they have multiple fractures, the wrist, the radius ulna together is not really considered a multiple fracture. That's a single site fracture, but multiple site fractures are not common. Most of your accidental injuries involve a single location. Multiple stages of healing would be concerning, and then certain types of fractures, particularly rib fractures. Complex skull fractures are not common from short falls, typically longer falls or complex falls. Acromion fractures, scapular fractures are unusual accidental injuries, but more common from punishment type injuries. Under a year of age, yanking on the legs or arms will produce a classic metaphyseal lesion that under a year of age is almost diagnostic of child abuse. Past a year, when they're mobile, they can do it to themselves. Rib fractures are concerning, particularly in infants. In this particular case, this child has a new one, and then one that's about 10 days old, and another one that is about a month old. And so this child had been squeezed by the chest very hard on 3 occasions. This child, the history was a 9-month-old who has this spiral fracture of the humerus. The history was the child put the leg through the slats of the crib and did it to himself. And we know a child that age is not going to have enough strength to be able to do that. This child has this bruise on the hand, which is concerning because it's not a common accidental location. And when you x-ray the hand, the child has a fracture of the metacarpal. And the history was that the hand was stomped on with a boot by an adult who was mad at the child. Abdominal injuries are the second leading cause of death due to physical abuse. An abdominal injury at any age and due to any cause that causes visceral injury is serious business. But in abuse, even more so, about double the mortality rate, mostly because, one, they don't usually come in and tell you that they kicked the kid in the stomach, and they tend to wait and not come in until the child's not recovering from the injury, so a delay in seeking care. Between the two of them, it's not too surprising that their mortality rate is considerably higher. you have different pattern of injuries inflicted injuries in an abdomen, more bowel injuries than you have with accidental injuries with automobile wrecks and bicycle wrecks. Head injuries is the #1 cause of death due to physical abuse. We now refer to them since 2009 as abusive head trauma, and it's not because shaking is not a significant cause of abusive head trauma, it's just not the only cause. And so the abusive head trauma the term was developed to be more inclusive of all the types of injuries that these children may sustain to their head. And it can involve anything involving the head and neck area. It is the leading cause of death due to child physical abuse. It is the leading cause of serious head injury under 2 and 95% of the serious head injury in the first year of life. It's roughly about 2,000 deaths per year in the United States. If you look at the incidence overall of abusive head trauma, it's somewhere under your year of age is when most of them occur, about 30 per 100,000, whereas it drops way down in the second year of life and even more so. The mean age is around 6 months with the median age and that peak age for infant inconsolable crying, which is 2 to 6 months. About a fourth of the children who have an abusive head trauma injury will die either immediately or in the first year. A fourth of them will fully recover and a year later appear to be normal, and about half or 2/3 of the survivors will wind up having disabilities. A little more than half are male. Most of the perpetrators are male, but can be either gender. This is an example of a forced feeding injury to the lips. This is an example of an eye injury, including scleral hemorrhage. Yanked by the hair, they may get a subgaleal hematoma, which can have a tremendous loss of blood, or loss of hair. So this is what a subgaleal hematoma will look like. Let's see. So it comes along right along the ear line right there. This was an example of traumatic alopecia being yanked by the hair. This is what it'll look like in a schematic form with direct blows to the eyes, as opposed to if they have a hit to the forehead, and then by gravity some of the blood will come down underneath the eyes but not involve the upper lids. So this is what it'll look like in real life. This is another direct blow to the eye type injury. With abusive head trauma, they have combinations of brain injury, intracranial hemorrhage with subdural hemorrhage leading the way, and may have retinal hemorrhages, and then broken bones, and may or may not have skin injuries. Bruises will be found in abusive head trauma in about 1/3 of the cases. Torn labial frenulums with forced feedings. About half of the children with abusive head trauma under a year of age will also have fractures, and then abdominal trauma. Shaking can be the only cause of the injury. They may also have shaking plus impact. Again, about 1/4 die either immediately or in the first year, and then about 1/4 come out okay, and half of them will be left with disabilities. Histories are critical when you're talking to somebody who has the head injury. What happened, and get details on it. When did the symptoms first start, and does the history match the injury or not? And if it does not, then of course that's when you have to consider reporting for further investigation. Typically the histories of the children who present with abusive head trauma will be things like fell off of a couch, off a chair, somebody dropped them while carrying the child. They found the child and it just wasn't acting normal, or just was eating and then suddenly started choking, or just suddenly stopped breathing. Trying to figure out between accidents and abuse is problematic. History is a big deal of it, and then looking at what the totality of the injuries are. But if you have an intracranial injury that's symptomatic and they have retinal hemorrhage, most of the time that's going to be child abuse. Minor falls can cause bruising and simple skull fractures, but rarely cause any significant intracranial hemorrhage unless they're falling from 2 stories or greater. This was a study published several years ago that looked at accidents that were confirmed to be accidental, witnessed accidents versus abusive head injuries. And subdural hemorrhage was much more common in inflicted injuries as retinal hemorrhages were, although you certainly can see them in both types of injuries. So to make the diagnosis of abusive head trauma, you have to first think about it as a possibility. So if you have intracranial hemorrhage, and particularly in a symptomatic child, and retinal hemorrhages, and with any other associated findings, and no history of an accident to explain it, you really have to be thinking about abusive head trauma. This was a study published just a few years ago that was looking at children under a year of age, and they did workups on these children to see if they had any other evidence of child abuse. So any bruising under 6 months, you have to at least consider it, and they found 8% of those had other evidence of abuse. Burns in under 6 months, mouth injuries, broken bones, about 1 out of 5 turned out to be inflicted. And skull fractures, most of the skull fractures are accidental. Intracranial hemorrhage, about 3/4 of them are accidental. Rib fractures, half of them will have other evidence of abuse, so that's a big red flag. And then subconjunctival hemorrhage is about 10%. Skeletal surveys are recommended on any child that you think may have been physically abused and should be considered selectively in children between 2 and 5 years of age. The yield on them is very low at 5 years of age and up, and are not recommended at that age group. If you have a child that you suspect was maybe a victim of abuse, particularly physical abuse, and you do an initial skeletal survey, we typically recommend doing what's called a repeat skeletal or a follow-up skeletal survey that's done usually 2 weeks later, 10 to 14 days after the initial survey. If they have a head injury, or if they're under 6 months of age, a CAT scan of the head or similar imaging is recommended routinely, and under a year of age is strongly considered, and between 1 and 2 it should be done if they have a head injury or have symptoms. This is what they formally recommend from the American College of Radiology for a skeletal survey. It involves 21 separate films, which is some of the regional hospitals tend to shorten that down and will cover entire extremities, and those are not adequate to identify the subtle injuries of the extremities. At Children's Hospital of Alabama, they add a couple more laterals in, so they actually are doing 24 films. But you want to do at a minimum what's recommended, which is the 21 film survey. In the United States, in all states and territories, there have been mandated child abuse reporting laws since the 1960s. Healthcare providers throughout the United States are mandated reporters. As a mandated reporter, you are required to report maltreatment when if you know or suspect the child to be a victim of child abuse and neglect. You don't have to know it. You just have to suspect, reasonable suspicion. You have to report in Alabama to a duly constituted authority, which specifically is defined as the Department of Human Resources in the county that you're in, or law enforcement, either depending on the police department or sheriff department, depending on whether you're in the city or county. There is a penalty to fail to report, which is it's a misdemeanor if you should have reported. With a possible imprisonment or fine. But for the child, if it's physical abuse and they're under 5 and you miss it and don't report it, then the kid's got a 50% chance they're going to get abused again, and they have a 5% chance they'll come back dead. You're supposed to report orally, either by telephone or direct communication immediately to DHR, law enforcement, and I would strongly encourage you for the healthcare providers that you can get your nurse or your secretary to call them and get them on the phone, but the healthcare provider should talk to the investigator directly. It makes a whole lot more difference, and it's just respectful from one professional to another to talk to them directly and tell them your concerns. You're supposed to follow it with a written report, which can be a copy of your office or hospital note from that day. You should include in there your suspicion and that you did make the report and who you talked to. In Alabama, licensed physicians, not nurse practitioners, actually can take temporary custody of a child when they have concerns for imminent danger of the child. They have to report to a duly constituted authority immediately, and they have to go before a judge within, typically within 72 hours. So those people who can take custody under law in Alabama include police, Department of Human Resources, hospital administrator, and then licensed physicians. Again, this law came about when nurse practitioners were not very common, and they were not included, and the law has not been updated since the 70s. So back to this case. So this child, the history is a child tripped while running and fell against the cabinet. And then asked, does the history match the injury? So looking at the child, the injury is, mostly on the forehead, and then you have the bruising here that is apparent under the eyes. And so can this child get this injury from tripping and hitting against the cabinet? And the answer is yeah, could be, because they smacked their head, it formed a little small hematoma, and by gravity it's drifted down underneath the eyes over a couple days. But it's also possible that the kid got popped on the head with something, as a punishment. And so, that one can go either way. This history, this 7-month-old rolled off of a couch onto a carpeted floor was the history. And as you look at it, you can see that these marks on the face appear to be an adolescent or adult size hand print. And it doesn't match the history they're giving. No way the kid could have gotten that falling off a couch. So this is a slap mark. And this is a kid who would need a workup. So a CAT scan of the head, a skeletal survey, an eye exam, a dilated eye exam to look for retinal hemorrhages. This history is this little toddler was walking along and bumped into the edge of a door, and within moments his eyes swelled up and looked like this. And could this history match the injury? And with normal, if the child was otherwise normal, that would be highly unusual. This is where, when you have unusual bruising, you're supposed to do a workup for simple clotting problems. In this particular case, when you did the CBC, the platelet count was 5,000. This child had idiopathic thrombocytopenia purpura, and while waiting for the lab test to come back, the child's popping out with petechiae and bruising scattered across his body. And you can get them in unusual locations without much trauma. So if you have unusual bruising, you should do the CBC, the PT, PTT, and consider a von Willebrand factor panel depending on the bruising. This child, the history is that she tripped and fell off a concrete porch onto a concrete walkway and gets this pattern of bruising on the buttocks. This is a kid that I would do a CBC, a PT, and a PTT on because of the amount of bruising. But in this case, the pattern of the bruising doesn't match with having falling onto the buttocks, and is more typical for what we see with somebody who's been paddled. And so this would be a case where the history does not match the injury and would warrant a report to DHR or law enforcement. So, in conclusion, child abuse is very common. Well, 4% of children get reported and investigated in Alabama every year. 1% are determined to be abused. Most of them are victims of abuse from the parents who are taking care of them or their related caretakers. It is a very serious injury, both for initial problems, but also long-term problems. Medical evaluation is important to identify the extent of the injuries and to match. Does the injury match the history that's given? But boy, it should be a whole lot better if we could just keep people from doing things like this to kids. Healthcare providers, including nurse practitioners, nurses, physicians, are mandated reporters throughout the United States. If the history doesn't match the injury, you have to consider it. That's child abuse. Corporal punishment in Alabama is legal, but it's reportable if it leads to physical or emotional injury. And if you conclude that an injury was inflicted, the diagnosis is child abuse. And you should report verbally, directly, usually by phone, followed with a written report. You don't have to use the special form that the Alabama has. Your note, your office note that's signed, electronically signed or handwritten signed, and faxed to them is adequate. You do not have to have the permission of the legal guardians to turn over your medical record on a child where you're making a report. You do not have to have their permission to take photos of the injury. as well, and you could turn those photos over to the investigators, and that would be either DHR or law enforcement. If you're not sure whether to report or not, the child is your patient. If the child is at risk, you're supposed to report. You should report. The whole idea of the reporting system is to protect the child from additional injuries. It isn't to go in and separate families. It's to go in and see what's happening. The family may be under stress. They may need help. They may need to find a different way of learning how to discipline a child. Yes, sometimes they do get separated, but to protect the child, that sometimes is necessary. And with that, I will conclude. And in the large audience that's here,